So the next presentation is Maureen Syowai. We'll be going through antiretroviral drug transition and adverse event monitoring among adolescents 15 to 19 years of age in Kenya.
Good morning, good afternoon, and good evening. I am Maureen Syowai from ICAP at Columbia University, and on behalf of my co-authors, I will discuss the findings of antiretroviral drug transition and adverse event monitoring among adolescents 15 to 19 years of age in Kenya. This is the outline of my presentation. The authors have nothing to disclose. Antiretroviral treatment optimization is critical for sustained viral suppression among children and adolescents. ART optimization began in 2017 in Kenya with the introduction of the dolutegravir-based first-line regimen for adults and adolescents above 15 years of age living with HIV. We describe the ART transition, retention, viral suppression, and adverse events among adolescents living with HIV, 15 to 19 years of age in Kenya. We conducted a retrospective observational study using the identified patient-level data from the Kenya National Data Warehouse from 1st July 2019 to 30th June 2020 from 918 health facilities. The figure on the bottom left shows the schema for the enhanced data system, and starting from the extreme left, we began by developing the adverse event symptom checklist using commonly known adverse events associated with antiretroviral drugs currently in use in Kenya, and integrated this into the national EMR. Subsequently, we triangulated the patient-level electronic data at facility level between the clinical EMR, the pharmacy ART dispensing tool, and the viral load database, using an interoperability layer to improve the quality of clinical interaction. This patient-level data is subsequently de-identified at facility level and transmitted to the National Data Warehouse for visualization. We used this de-identified database in our analysis. Descriptive statistics were used to summarize patient demographics, regimen distribution, retention, viral suppression, and adverse events among adolescents 15 to 19 years of age. And chi-square tests were calculated to determine the level of significance of viral suppression between dolutegravir and the Adherence-based regimen. A total of 22,237 adolescents aged 15 to 19 years were identified, accounting for approximately 20% of all estimated adolescents living with HIV 10 to 19 years of age in Kenya. 54% of adolescents living with HIV were female. The mean age was 17 years for both males and females, and 80% of adolescents living with HIV were on first-line antiretroviral treatment. On the left side of the screen, we analyzed the first-line regimen contribution for the 17,865 adolescents on first-line regimen, and 47% were on a DTG-based regimen. On the upper right side of the screen, we present viral load data from adolescents who had a viral load done within the past 12 months. And for the overall population of adolescents, 84% were virally suppressed, whereas those on first-line ART had a viral suppression of 86%. On the lower right graph, we compared viral suppression between dolutegravir and the Adherence-based regimen, and the viral suppression was at 90% for dolutegravir-based ART and 83% for Adherence-based ART with a significant p-value. Adverse events were graded for all adolescents on ART using a standardized adverse event grading criteria, and the graded adverse events were recorded as mild, moderate, or severe. There were 2,152 adverse events reported over the data analysis period, representing 10% of all adolescents. Only 6% of adverse events were graded, with majority of the adverse events being ungraded. The bar graph on the right highlights the top 10 adverse events reported, and the top 5 overall adverse events were anemia, headache, abdominal discomfort or pain, hyperlipidemia, and suicide ideation. On the left-hand side of the slide, we see the top 5 ungraded adverse events, and these account for 64% of all adverse events. The adverse events associated with dolutegravir and efavirenz were 48, and these accounted for 2% of all reported adverse events and 45% of antiretroviral-associated adverse events. There were no severe adverse events associated with dolutegravir, while 13 severe adverse events were due to efavirenz, and all these were gynecomastia. On the left side of the screen, we see that the 6-month retention for all adolescents living with HIV with an adverse event and with at least 6 months of follow-up time was at 93%. And on the right side of the screen, we see that the viral suppression for adolescents with an adverse event and who had a viral load result done within the past 12 months was 81% for all adolescents, 98% for adolescents with an ART-related adverse event, and 100% for both dolutegravir and efavirenz-associated adverse events. In conclusion, we see that 1 in 10 adolescents living with HIV aged between 15 to 19 years on ART had a reported adverse event. Adolescents on dolutegravir-based regimen had higher rates of viral suppression, and no dolutegravir-associated severe adverse events were reported. Good retention at 93% and viral suppression at 81% amongst adolescents living with HIV with a documented adverse event. However, there is a need to improve the capacity of the healthcare providers to grade and report on severity of adverse events. I would like to acknowledge the Ministry of Health, NASCOP, the County Health Management Team, the Palladium Group, CHAI, PEPFAR Implementing Partners, the RISE Team, USAID, and PEPFAR. Thank you.